Thanks for joining us, everyone. My name is Kelly Dewey. I'm a licensed professional counselor here at Williamsville Wellness.
My name is Emma Land. I'm also a counselor here at Williamsville Wellness.
And we wanted to focus this podcast today on having a discussion about the importance of including family support in our treatment and what that looks like. So, Emma, what would you say are some of the main reasons why we include family support in our treatment here?
Yeah, so I think jumping into this topic, let's start by defining family. I know when we hear the word family, we think, the people I'm related to, which yes, that is family, but we also can make our own family. These are the people that support us most, the people that are there for us when we need them, right? So family doesn't always have to be defined by blood. Family can be defined by who shows out for us, who makes us feel like we matter, who's there in times of need. And I want to lead with this too, because I think sometimes when you go into treatment and maybe, you are cut off from family members, or you've cut off family members, or you've had a lot of family members pass, it can feel isolating if the program includes family therapy because of kind of the definition we're attaching to the word family. So I think it's important to start our discussion about this with what is family, what defines family, and how can we remove the boundaries and barriers that we have placed on the word family to be more inclusive of what families actually look like. We have the quote unquote standard, or what society classifies as a family unit. But that was different for everybody. We're coming from all walks of life. Kelly, what would you say you define as family? What does family mean to you? Or how have you seen family look different?
So I think I want to answer that question based on how I have seen family play out for our patients here. So definitely we have sometimes the stereotypical family that we see where a patient is coming and they need to involve their spouse or their partner. And we can also include parents or siblings or children, as long as they're adult children. But we also are able to see that some people have stronger support systems with their friends or people that are in recovery. So I think, as you're saying, family isn't just a one-size-fits-all kind of term. It can really just include anyone who you can go to and trust and rely on, and someone that can hold you accountable as well. So I think a family member, when we're thinking about someone involving themselves in our patient's treatment, needs to be someone who holds a lot of those qualities of trust and accountability, and someone who's non-judgmental as much as they can be. So that's how I've seen it play out for our people here.
Yeah. And I think, to go back to your original question, now that we can look at family, as more fluid and less rigid, we can see why it would be most important to involve these people that are our biggest supports, or help hold us accountable, show up for us, because we're not meant to do this alone, right? We walk a line between codependency, being overly dependent, but also being very independent, unhealthily independent. We are supposed to be in community with people, and recovery itself, the 12 steps, AA, NAGA, etc., is founded on that group, that community group of, I come together with people who can understand me, and I share my struggles, what I'm going through. And it's the same thing when you're involving someone in treatment. Your support people need to be a part of that. They walk with you through the struggle, and if you want them to walk with you through the recovery, the triumph, that this is that transitional period that you really need them in. I think it can be, and maybe you can speak to this too, but really scary to involve family when we're going to treatment. It's like I'm airing all my dirty laundry in a way at the beginning. I'm maybe exposing secrets that I hadn't told anybody, not even my closest family, friends, support people. And the thought of, oh my gosh, now I have to tell them can be very terrifying. But that hurt, that discomfort that I might associate with that is very necessary. What, Kelly, would you say you have seen in terms of maybe the holding back from wanting to involve family in treatment? How do you see that? How would you speak to that?
Yeah, so I see our people have concerns about involving family for different reasons. Not everyone has concerns about it, but when they do, it can often be like you're saying, that fear of I don't want to have to share everything that I've gone through, or this is scary to really be this vulnerable. I think vulnerability is something that a lot of people are struggling with an addiction, and when you're coming into recovery, we're asking you to be vulnerable. And to be vulnerable is to give someone else the power to hurt me if they want to when I share my stories. But we, of course, as therapists, have to foster that vulnerability in a positive way that then allows them to try to practice that with their closest support. So I see that the vulnerability is a big component of why people are so worried. So that some is that fear, but also not even knowing how to be vulnerable or what it looks like, or what am I sharing, what is too much, and what do I do if my family member or support doesn't respond well. So making sure that they are able to talk that through with us so that we can plan or problem solve or role play in whatever way we need to get them a little more comfortable with the conversations we will potentially have with their family and support.
Yeah, like what you're saying there, the what ifs start to flood in, and I am so consumed with the possibility of how somebody might perceive my attempt at being vulnerable. And I think too, when we're talking about involving family in treatment, the stakes are high. These people know the most about me. Maybe they don't know everything because I kept secrets. I'm hiding. I have a lot of shame. I don't want to expose that. But the stakes are high because they already do know a lot about me. And most likely, most often, they're going to continue to know more about me if they are a part of my future. So it's not, it's a stranger that I can feel so quickly connected to and tell them all my deepest, darkest secrets. Or I walk in an AA meeting and I already know that it's a non-judgmental, stance that everyone in that room is taking. So I can just share everything. It's people that I've got to continue to confront and come face to face with in the future. And they've already been a part of so much of my past that those stakes feel high and that risk feels terrifying. It feels huge. Yeah.
Yeah. And when you have had conversations with family members or people in their support, and the family member is sharing, like, what do I do? How do I help? Like, where do I even start? What are some of the things you like to say to them?
Yeah, I think that's a very common question and a very common worry for family and support people to have of like, what do I do? How do I help? I tried all of this. I'm at my wit's end. I don't know what else to do. And I think the most annoying but simplest advice is it's not up to you. And I think that that's very hard because when we're talking about a parent-child dynamic, if the child is the person struggling with addiction, parent doesn't want them to struggle. I want to rush in and save. I don't want you to have to feel this pain. Let me unburden you and take it on. But that is not helpful because for whoever the person is to be support people that's struggling with addiction, it's up to them. It's ultimately, there's nothing you can do, say, think, feel that will change how they approach this. And I think that's really scary. But I think it's something as support people that we have to come to grips with, accept in a way of, there's nothing I can do, but I can show up and I can show my care and compassion, and I can hold them accountable to a certain degree. I can ask how they need me to support them, and I can do all those things, but that won't determine the outcome. And I think sometimes that can also take a lot of stress away from a support person, but also add a lot of stress for a support person. It's like a double-edged sword there with that one, I would say.
Yeah. So I think it's helping them look at it realistically of what they are in control of with their loved one's recovery and what they are not in control of. As a lot of people want to have the belief that they can fix the person. Yeah, you have to make sure that that rhetoric or mindset is not present in the recovery of the patient and the family because you can't control how it's going to go for them, but you can have helpful behaviors and actions and help with accountability in different ways that are within your control.
Yeah, it's like the kind of, I don't know if slogan's the right word, but Al-Anon, Nardon, I know they say often like the 3 C's theory, you didn't cause it, you can't control it, and you can't cure it. And I think for support people, all three of those are really tough to kind of accept fully. You know, I want to take all the blame or at least find fault in something to figure out what caused this. I want to control it because I don't want this to continue. It's hurting them and it's hurting me. Yeah. And then I can't cure it, coming to grips with that this is lifelong too. Think about how overwhelming that already is for the person trying to enter into recovery. That's just as overwhelming for the family members too. You know, they have been through their own turmoil in this person's active addiction by being a part of their life and trying to support them and be there for them. So it's overwhelming for everybody involved.
Yeah.
Yeah. What let's talk about, just to go off of the 3 C's, you didn't cause it. What do you say or what do you see most often when a family member support person is kind of harboring maybe some of that guilt about what did I do to cause this?
I think that when it comes to what we realistically can do with our time here in family sessions is I want to make sure that person has space to share that in the family session and understand where that's coming from. But I think we also need to emphasize with that family support person that getting their own program of recovery from this is going to be important. So they might not be the one struggling with the addiction, but because their loved one is coming into recovery, they are coming into recovery as well. So they need time to go to individual therapy or go to Al-Anon or any recovery meetings that can help with that CODA for codependency. So I think that we in our treatment here can give that family member space, acknowledge where that comes from and why it makes sense they would feel that way, but then also reinforce the importance of seeking their own help and therapy.
Yes, yeah, I like that you bring that up because I think it's really important to highlight too. The person entering treatment is not the sole problem in the dynamic. Everybody has something that they need to change or work their own program of recovery. You know, the person in active addiction is going to be working their recovery and it will look like this, but everybody else in that unit has to be working on something themselves, because if you come here and you do all this self-reflection, self-awareness work, learn all these coping skills, but nothing changes in your environment, you know, it is going to be much more difficult to sustain that program of recovery.
Yeah.
So looking at it that family is a unit. It's the whole is greater than the sum of its parts. It's not one part is the thing I have to fix or change. We all need to be malleable and able and willing to change in this process for the benefit of the individual who's entering recovery, ourselves, and the entire unit as a whole.
Yeah. Yeah. If one part of it changes, they all change. So finding a new homeostasis that can look like recovery instead of the homeostasis, if you even had that was there with active addiction.
And in homeostasis, we think homeostasis, equilibrium, peace, but the chaos becomes homeostasis because the homeostasis is just whatever's predictable and the chaos starts to become predictable. So it's looking at that as something has to change. If it stays this way, nobody's moving forward. We're all stuck and looking at each other, pointing the finger. You're the problem, you have to change. No, we all have to be in the mindset of we're all changing if we want to see steps forward, if we want to see progress. What do you find? Because I'm talking to the time frame we have the family therapy here. Being a 28-day program, we don't have a ton of time. We try to incorporate it as much as we can. But what do you find is some of the main goals or points to hit on in the family sessions while patients are here with us?
Yeah, one of the most important ones that comes first is addiction education.
Yes.
We typically have one of our peer recovery specialists who have been through addiction and their own recovery start out with the family member and support and speak about what addiction really is, the disease of addiction, how it manifests, and how it plays out in everyday life. It's educational, but it also normalizes what the person has gone through and what their family has gone through, helps them make sense of it. And then those peer recovery specialists can also speak to what recovery can look like, what the steps are going to be that our patient is going to need to take for that, and how the family can be supportive of that too.
Yeah.
And then from those sessions, we can have others that speak to, how has the family member been emotionally impacted by the addiction and the relationship? What communication strategies do we need to improve? How can we start rebuilding trust? Can we look at codependent patterns and point out things that might need to change? Those are some that come to my mind. What about you? What am I missing?
Yeah, I think the codependency rings a bell for me because we can offshoot that into communication styles, attachment styles, like looking at how all of that is playing a role here. Rebuilding trust, huge. I think emotional expression is another one that we need to focus on if most beneficial to the individual and the family member. Maybe if it's a child who is the patient and the parent is who we're doing family therapy with, and they maybe exhibit a pattern of people pleasing and wanting to act like they've always got it all together and are afraid to let mom or dad see that I'm really struggling and I need help. We can use a session focused on expressing that emotion, being able to admit I am struggling, I make mistakes, and I've just been faking it and I need somebody to see that. I think for me, one of the best goals in family therapy is, does the patient and the other people on the other side of the screen, whoever those people are to the patient, do they feel seen and heard? Everybody has a story and a perspective that's worth sharing and acknowledging in a sober, clear mindset. Because when the individual is in active addiction, being able to acknowledge the impact that I'm having on my support people is very difficult. I am wrapped up in way too many other things for that even to be on like the docket list of what I need to pay attention to. So giving the space just for that, to be able to see each other.
Yeah, I think those are really important, especially in the middle of someone's treatment and then coming to the end. Family sessions can also focus on, what does this person have set up for their discharge plans? What aftercare appointments are they scheduling? They could share what they've been learning about their triggers and their warning signs, their coping skills, so that their family member can have awareness about that. And I think one other thing I always like to share when I'm doing family sessions is, how can the family member, support person respond to their loved one when they're having a hard day or when they're having craze? Because that is probably going to happen. There have to be tough times. Your mind is going to think about wanting to use or drink or gamble again. And you don't want that to stay locked in your head. I feel like you can't share it. So making sure the family member knows that that could be a possibility, and how do you want to respond, or how does the patient think the best response would be? And I also say, it's a pretty good sign that this person doesn't want to relapse if they're coming to you and telling you they're having these thoughts. Because if they wanted to relapse, they wouldn't share it. They keep it to themselves and keep planning that relapse. But sharing, hey, I had a really tough day and my mind just kept trying to bring me back to this, I just wanted to tell you, is something that can help rebuild that trust, knowing that, hey, they're trying. They're identifying that they're having cravings and they're trusting me to hold that for them. And we can figure out if we need to problem solve or get you to see your therapist or just talk it out more. But I think it's important for that to come up in family sessions so that it's not a shock when that kind of conversation comes up in their recovery.
Yeah, I think that continuation of care, we're doing the sessions here, we're preparing for after here. I think in some cases, maybe seeking more family therapy in the future. I think there's just so many benefits to sitting down in front of a person who has an outside perspective and can see things in communication that two people, when we're going through something, talking about something, can't see in that moment. So just continuing that. So, when I do say, oh my gosh, I'm having a craving, I really want to place a bet. I can process that in family therapy, in outpatient, if maybe the response wasn't what I was looking for or what I felt I might have needed. All in all, that continuation of the family help, the family work, is so crucial, so beneficial, because we can't do it alone. I need people around me. I need community. I need support. Yeah. Well, thanks everybody for tuning in today and talking about some family therapy and treatment with Kenya.
Thank you. See you next time.